When it comes to this manipulation that you were saying, so is that ethically manipulated? And I mean, since a lot of your stem cells are not potent, and you have to, when you extract, you do have to have that. So one is that whether this is all, as per approved standards, and secondly, where is it used? Where all is?
The thing is, like if you talk about ethical approvals, dental stem cells is 100% approved because we are not doing any invasive surgeries. It is actually the exfoliating tooth, the tooth which is going to fall. We consider that as a medical waste, like umbilical cord. We don't use it for anything, and we are not harming the kid. The major important point is we are not harming the kid. We are helping the kid for its future uses. And if you talk about applications, actually there are in different segments. If you consider nerves, when you consider nervous system, it is clinically used in Parkinson's disease, Alzheimer's disease, spinal cord injuries, muscular dystrophy, and nerves injuries. There was one case treated which was published in Hindu. There was one person, if I'm not taking much of the time, I'll just brief it up the example. There was an optic nerve which was damaged due to burn injuries. And in one institute, they have regenerated the optic nerve with the use of stem cells.
That person's?
Yes, bone marrow from this. And induced pluripotent stem cells, it's still in the infancy stage. They have been trying to able to convert the normal cells into stem cells, but using your own stem cells. Actually, this is the major difference between using stem cells, because there is something called as HLA matching, human leukocyte antigen, which is the one which is used to accept. Like in body, if you are doing organ transplant also, that is the major criteria which they use. HLA matching is there, your body easily accepts, otherwise it rejects. So when you do the stem cell therapies also, it is the same. If you have your own stem cells stored, it is called as autologous. It will easily accept, and the regeneration happens. And stem cells are very brilliant cells. They are highly programmed in such a way that, see, your skin is regenerated, and it's not like cancer. It is only how much quantity is required and whenever it is required. So the stem cells have that highly programmed activity. They develop in very controlled environment and highly programmed. So it is like that. If you're taking stem cells or from other sources, it is allologous. Yeah. So the chances of rejection is very high when you compare to the autologous stem cells when you have of your own. If you have a chance to store your own stem cells, why not do it?